check, 1, 2, hey, 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 check, 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 1, hey, hey, check, 1, hey, check, 1, 2, hey, hey, 1, hey, check, 1, 2, 3, check. Check, 1, check, 1, hey, check, 1, check, 1, 2, hey, check, 1, hey.
नवा को तो ऑडियंस को यूज बेस्ट का मैं बज check 1 hey check 1 hey check 1 2 3 check 1 hey check 1 2 hey check 1 2 3 4 check 6 check 1 hey check 1 hey check 1 2 hey check 1 2 3 4 5 6 check 1 hey check 1 hey 1 2 3 check 1 hey check 1 2 hey check 1 hey 1 2 hey check.
Check 1 2 hey check 1 2 hey check 1 2 hey check hey check. check, check. Check one, check, hey, check.
No, 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 don't worry. Dr. Krishna is coordinating and will explain.
check, 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 check 1 2. Hey, check, hey, check.
उधर को इधर से आउटपुट
हाँ दे दिया ना
वो एक
हाँ
कन्वर्टर दे दिया
वो अपने से कन्वर्टर है
उसके पास एक कन्वर्टर था
ये पूछा था मैं डायरेक्ट दे दिया और यार अभी आ रहा है कि नहीं आ रहा मालूम नहीं है उसके देखा मेरे को तो एक ही नहीं चाहिए था कोई प्रॉब्लम
जो आपको
नहीं मेरा ये 1 2 है ना
हाँ
ये मेरा है
ओके
खाली थोड़ा सा इंक्रीज करना
बहुत ज़्यादा ऑलरेडी हो गया है
कितने किया था
देखिए फेडर में भी ज़्यादा कर दिए हैं
और मैं खाली ये 1 2 का इंक्रीज करा
यस वही फेडर में भी देखिए इसमें से 5 ज़्यादा है
अच्छा
ओके और इधर को भी देखिए इधर को भी देखिए 3 dB ज़्यादा है आपका
ठीक है मैंने उधर भी एडजस्ट कर दिया
सब में किसी चेंज नहीं समझ ठीक बा जोर करो
check 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 okay select one or zero जतो माइक में जिका सेकंड जतो माइक में जिका सेकंड
check 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 1 hey check 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 नहीं आ रहा
check check बटन
check 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 1 hey 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 check 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 check
Check, 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 check 1, check, 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 check.
एक नंबर इधर पूरा पीछे दे दो हमें
चेक कर सकते हैं बात करना
Check, check.
check, 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 check.
मैंने बंद कर दिया, नॉइज गेट डाल दिया, हो गया।
Tolong cik lekas channel lain tu kau yang bela lain tu lah. Tak kisah. Cik macam
Hey, check, check, hey, check. Jom ke tak? Itu jom, jom. Cukai na? Baik mudah. Okay.
मास्टर माइक का दिखते ना।
check. Check, 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 check.
check, check, hey, check, check. Check, hey, check, check, check.
Hello, hello, check. Yes. Yeah. Good morning to everyone. A very warm welcome to all the dignitaries, delegates, jury members, as well as the quiz participants. Warm greetings from Fever Foundation of India in the background of the grand finale, which is happening at the 7th Annual National Conference of Fever Foundation. And also, greetings to all the people, all the PG students, and the faculties and the doctors who are joining in through our online platform. This is live streamed across 10 different satellite centers, medical colleges, and through our online platforms, which are being streamed, as well as the YouTube channels of Fever Foundation is being streamed. To start with, a brief introduction of Fever Foundation, the activities, what we do. I'll just take 2 minutes of the time with the permission of the quiz masters and the jury. Can I have the slides, please? Sharif? Yeah. Fever Foundation is an independent body which takes care of all the activities related to fever. It's an independent non-commercial foundation supporting the educational academic activities to address the unmet needs in fever management. The foundation is committed to conceive, build, and sustain programs and make scientific initiatives aimed at providing evidence-based updates to all the clinicians related to fever management. Next slide, please. So the vision of us is to strive towards imparting knowledge on the unmet needs of and provide information on research, education, and therapy updates in fever management. We have various gamut of activities. One in as such activity is the annual National Fever Conference, which happens. Along with it, we also have the fever CMEs. We come out with books. We also have started with the epidemiological research. We have PG specific activities, including the quiz competition, poster competitions, young scholar awards, as well as the paramedic, patient education, and the parent education activities. Today's the quiz, we conducted as all of you are aware of it, the Fever Foundation conducted the zonal level quiz across India, which happened, huge success this time around. We had more than 1,600 PGs participating in our zonal quiz. And we have shortlisted or the 2 winners from each of the zone, and we are happy to host all of you here in the PEFCON 7th Annual National Conference. The jury for the quiz today, we have Dr. Next slide, please. Yeah, Dr. M.K. Sudarshan sir is the ex-director of KIMS professor and also former chairman Karnataka government of COVID task force, as well as the member of the WHO expert committee. Also, we have the special jury in the Pediatricians Hall today. We have Dr. Isaac Moses sir. Sir doesn't require any introduction. He's been the former dean, also the HOD and the medicine at the Stanley Medical College, and also he has in various capacities held the national and international posts. So welcome, sir, for being the jury today. And we have the the teacher of teachers, Dr. Sukumaran sir. Thank you, sir. Thank you for joining us as the jury today. And he's been the past president of the Indian Association of Pediatrics as well. Thank you, sir. We also have Dr. Ananda Kesavan, sir. I think most of you might have seen him very familiar in our poster competitions and the previous quiz as well. Thank you, sir. Thanks for being here with us and being the guiding force in conducting various student-related activities of your foundation. Thank you, sir. Also, we have Dr. Anand Vasudev, sir, from Delhi joining in today. Sir has been instrumental in conducting various workshop activities for us and also preparing charting out the agendas on various scientific events. Thank you, sir. Thanks for joining in. And Yagnesh Popat, sir, as always, is there for us for every activity and is also being the, what do you call, the man behind all our difficulties. Wherever we have, we always stop at him and he has been the guiding force for various activities of your foundation. Thank you, sir. Thanks for joining in. And we have the quiz masters today. Next slide, please. We have Rashna madam. I think all of you does not require introduction. Last 7 years, she's been the quiz master and conducting the quiz. And madam is the professor and superintendent at the Postgraduate Institute of Medical Sciences from Meghalaya. And also she has various posts held at IAP and she's been an ardent speaker at various national and international conferences. Thank you, ma'am. Thanks for accepting the invite and successfully helping us. And this is the 7th year we are conducting in row the quiz. And I think this is the first time we are having the grand finale in physical round. I think thanks for all the advisory board members and the jury and the quiz masters for helping us to host this event. And we also have special invitees and the quiz masters. We have Dr. Vishwanath Kamoji, sir. Sir is the lead pediatric and neonatal consultant at Spurs Hospital, Bangalore, and also as well has been there at Columbia Ishwa and Manipal hospitals. Thank you, sir. Thanks for accepting our invite and thanks for being the quiz master today. Also, we have Dr. Balivan, sir. Last 2-3 years is there with us, helping us on various activities of Fever Foundation, helping us instrumental in preparing the modules or the quiz as well. Thank you, sir. Thanks for joining in. So, I'll just take about the rules and regulations of the quiz. So these are the basic rules where the quiz, this is only for the postgraduate students. The quiz consists of multiple choice questions and there are few rounds where there are open-ended questions as well. Each round will have a time limit for answering questions. No, at any given point, you cannot be using any of your mobile phones or any other electronic devices other than what is being given by the jury members or the organizing committee. Once the answer is submitted, it's not possible to revert, and at found any type of foul play, automatically the candidature will get disqualified. You cannot be seeking questions or answers from your colleagues or from people sitting nearby or any of the audience. These are the general rules which I want to make it clear again. PO Foundation will not be responsible for any of the technical form of error, and participation of the quiz implies that participants will accept all the integrity of the rules. Non-compliance with the rules will result in automatic cancellation, and whatever the decision taken from the quiz masters and the jury will be final. So how do we go about the rounds? Today we have 4 different rounds. The first round is the general round with multiple choice questions. The round 2 will be the case-based round. Round 3 will be the image round, and the round 4 is the buzzer round. I'll just explain in brief every round. We can have the next slide, please. The round 1 will have direct questions with 4 multiple choice options. It will be passed on, it will be a direct question to each candidate, and there will be no passing. Whoever answers right will get 10 marks. And the timeline is the entire duration, which in the entire quiz format, it's 15 seconds. And there is no negative marking in this round. Round 2, 1 question will be asked to each candidate. If that candidate answers right, he will get 10 marks. If that candidate is not answering, it will be passed to the next candidate. So this is a passing round, but it will be passed only to one person or the one person sitting next. That's it. The passing will happen to only one person. If the person answers right, he will get 5 marks. Round 3, a question will be asked. This is an image based round. During this, a tab is kept on all of your tables. The questions will be displayed on the screen as well as the tab. When the question is asked, all of you are supposed to answer in the tab. except for the person who is answering. When the question is directed to, for example, if it's directed to person A, then the person A should answer within 15 seconds. In the meanwhile, the other B, C, D, and E other candidates should answer in the tab. The time limit is 15 seconds. When the question is being asked to that person, all of you will answer simultaneously. In the process, if that person does not answer right, then whoever has answered right will get 5 marks. All the people who are answering simultaneously when that person has not answered will get 5 additional bonus marks. Clear, all of you? Next round, this is the buzzer round, where the fastest finger, the buzzers are kept on off your tables. You need to press the buzzer, then the quiz master will ask to answer the answer. This buzzer is such a way that whosoever presses first, the light glows and the other buzzers will get deactivated. No matter if you press also, it will not get deactivated. Yeah, and the answering is, if there's a typo error here, it will be 5 marks for each of the right answers. Okay. And the last will be the tiebreaker round. If we get into the tiebreaker, again that will be the buzzer round. So these are the rules and regulations of the quiz. So what we have done is, with the permission of the jury members, what I'll do is, next slide please. Yeah. To introduce, with the permission of the jury, I'll like to call upon all the people present here. We have Dr. Sonu Prajapat, Dr. Revant, Dr. Vijaya, Dr. Nili Mehta, Dr. Chinmay Jaina, Dr. Vivek, Dr. Shankar, and Dr. Vidyashree. These are the 8 people who got qualified for the finals. Unfortunately, we don't have 3 of them for joining us today. We have 5 people joining in. We have Dr. Sonu is here. Yeah, Dr. Sonu, please onto the desk. Just be here. So what the seating position, again, with the permission of the jury, there will be a chit based which they need to pick it out. So next is Dr. Vijaya. Dr. Revant, I think for some reason, personal reasons, he is not able to join us today. Dr. Chinmay Jaina. Dr. Shankar. And Dr. Vidyashree. I'd like to request Dr. Isaac Moses sir for on the desk, please, to take out the chits. I think it's time for me to hand over the sessions to our quiz masters, Dr. Rashna ma'am, Dr. Balivan sir, and Dr. Vishwanath sir. It's over to you. Thank you. Yeah, I request all the participants to introduce yourself so that we can write down your names in the back end as well.
My name is Dr. Sonu Prajapat. I am from Dr. SN Medical College, Jodhpur, Rajasthan. Thank you.
Myself, Dr. Chinmay Jana from Kaling Institute of Medical Sciences, Bhubaneswar, Odisha.
Myself, Dr. Vijay Ruge. I am first year pediatric resident at IGGMC, Nagpur.
I am Dr. Vidyashree Gundala. I am from Kakatiya Medical College, Warangal.
Myself, Dr. Shankar Dodmani from Karnataka Institute of Medical Sciences, Hubli.
So, very good morning. You are representing different parts of the country. Now you are already winners. So only you are winners of your region, and also we can select only one as a first. So don't mind it. So you are all winners of your zones and whatever is your college, then your zones, whatever it is, and all the best for all of you.
Dear friends, let me at the outset congratulate all our postgraduate students who has come forward for this quiz program, and I wish them all the best. Thank you. Yes.
Disadvantage of being short. So I'll have to come this side because I can't see this. I can't see this also. So good morning to all our respected senior members of the jury and my colleagues, our quiz masters, and of course the participants. So what we'll do is we'll start first with some dummy questions so that you get used to it. And the tabs, have you seen if they're on and off? Because we'll be using that for one of the rounds. Okay, they're all on without password. So can I ask Uma to display the first question? Okay, so this is on Bangalore city. Our own Bangalore is called the city of blue city of India, Silicon Valley, traffic jam city, and lake city of India. This is not for the quiz participants, it's for the audience. So we give you, your time starts now, 15 seconds. All of the above. But that choice is not there, Nazar. Will come. Okay? So at the end of 15 seconds, we will display the answer. So can I have who wants to say traffic jam city, Agnesh Popatji? Anybody else? Silicon Valley city. I think both are not correct. Can you display the correct answer? It's, I think, Lake City. Acha, oh. So we have to give special prize to Vasudev sir. Okay, then we have one more question. So just practice. Mysura is famous for Mysore silk, Mysura Deshera, all of the above? Okay, so this is how it will go, okay? Within 15 seconds, you have to give. Okay? So all of the above? Yeah, so correct. Everybody gets a prize. So we'll go to the main quiz now. So we'll start with A, which is Dr. Sonu. So can we have the first round questions? So fever in children under 3 months should be considered normal, low risk, high risk, or self-limiting. Your time starts now. High risk. Okay, so his answer is high risk and he has answered within 15 seconds. So can we display the answer? So high risk. Very good. Congratulations. So he gets full marks for question 1. So before you would like to, Uma, you would like to display the answers also, na? Okay, okay. So this is the reference from where we have taken this particular high risk definition of fever for below 3 months. Any of the juries would like to add anything, sir? Sukumaran, sir.
Yes, as you all know, fever is a very dangerous sign in children less than 3 months. Especially fever without localization should be considered very seriously. And in the management also, all these babies should be admitted in the hospital. We must have an inpatient management for these children, and these children should be investigated. Initial investigation include ACBC, ESR, CRP, urine microscopy, urine culture, and that persistent fever is there. We must do 3 punctures, either a urine culture, CSF culture, and blood culture should be done. Should be taken very seriously, and you should start antibiotic depending on the condition of the child. Thank you.
Another point is that in newborn, even though there's infection, the child may present with hypothermia and fever should not be there. So we have to always keep in any child, because fever may not be a marker in the newborn. You may get, instead of getting fever, you may get a hypothermia also.
Yeah, so very good point. So below 3 months of age, all are to be considered as high risk and admitted and given antibiotics. So you can't send these patients off. And what Anand sir has said that those in the newborn period may not have fever. They may have even hypothermia as a presentation. So thank you very much. We will go to the next question, which is to Dr. Chinmay Jena. So can we have the next question being displayed? Which of the following is a major criterion in the diagnosis of in the revised Jones criteria for diagnosing acute rheumatic fever in high-risk population? Polyarthralgia, B, fever more than 38, C, ESR more than 30 millimeters, D, CRP more than 3. So your time starts now.
Ma'am, A, polyarthralgia.
A, polyarthralgia. Very good. So juries, I think this is the correct answer. Sukumaran sir, would you like to throw some light on the new Jones criteria?
See, in the previous Duckett's Jones criteria we were following, there were 5 major criteria were there. It was polyarthritis, carditis, subcutaneous nodule, chorea, and erythema marginatum. And arthralgia was taken as a minor criteria in the previous Duckett Jones criteria, and now polyarthralgia is taken as one of the major criteria for diagnosis of rheumatic fever. And fortunately, we are now seeing less and less cases of rheumatic fever now. Why? You know why it is so? In Kerala, we have got a rheumatic fever prevention program is there. And as the years pass, we are seeing less and less children with rheumatic fever, because it is because of the injudicious use of antibiotic by pediatricians. All children with fever, they are getting amoxicillin. Amoxicillin will definitely cover streptococci. So the incidence of rheumatic fever has come down. And polyarthralgia is taken as a major criteria for diagnosis of rheumatic fever.
Any of the other members? No? Okay. So, yes, Dr. Balivant, he wants to say something.
So even monoarthritis can be considered as a major criteria in the high-risk population, moderate to high-risk population, especially when they are not on any anti-inflammatory or any immunomodulating agents.
Thank you. So, Uma, can we display the reference for this? Yeah, so if you are in doubt, then you please again go back and read this textbook. So, so full marks goes to Dr. Chinmay Jena for the second question in round 1. Next, we will move on to the third question, which will be for Dr. Vijaya. So, which of the following helps to transmit babesiosis? The first choice is the Ixodes tick, second is trombiculate mite, third is derma center tick, and the fourth is amblyoma tick. Your time starts now. Option? Do you use the mic?
Option A.
Option A. So you go with Ixodes tick. Okay. Can we display the answer, please? Yeah. So she is correct. So, sir, what about the other ticks which you have displayed here?
It's called as a chigger. So commonly caused as scrub typhus.
Scrub typhus.
Yeah.
Yeah.
So the dermacentetic called as a dog tick, Rocky Mountain spotted fever
Yes.
caused by this. Amblyommatic actually kind of a ehrlichiosis. It's
Ehrlichiosis,
also
yeah.
a rickettsial infection. Amblyommatic causes hot water fever.
Yeah. So, yes, sir, you want to say something else? So, most of the other ticks, you know, these babesiosis and all that are more common. I'll ask you an off the syllabus question. In which animal? Any idea? So, if you have dogs at home, you have to be very careful of all these ticks because ehrlichiosis, babesiosis, and all these are very common in dogs because of the tick bites. So, we will go to the, so full marks to team candidate C, that is Vijaya. We'll go to the next question, that is for Dr. Vidya Shri. So, Vidya Shri, what is the causative organism for the fifth disease? A, measles, B, parvo. We wait for the question to end. A, measles, B, parvovirus, C, mumps, D, herpes. Your time starts now.
B. Parvovirus.
B, parvovirus. Very good. They're all very smart. You can display the correct answer. So, sir, you want to say something about parvovirus?
Parvovirus infection, we see children with parvovirus infection. And the main problem in this, with this virus infection is that it can produce other problems like pancytopenia, plastic anemia can be a manifestation of a parvovirus infection. As PGs, we must know the order of all these viral exanthem. Do you know what is the first viral exanthem to be described? Yes? First viral exanthem.
Varicella.
No.
First day fever, you want to say that?
No. First viral exanthem to be described.
To be described.
First one is measles. Second one is scarlet fever. Third one is rubella. Fourth one is Duke syndrome. Fifth is fifth disease. Then you have got the sixth disease. This is the order of.
Thank you, sir.
Okay.
So, and again, I'll come back that even in parvovirus, you also get pure red cell aplasia. You can also have multi-system involvement like a joint pain and all. So it can simulate a rheumatological disorder. And again, this is a very serious infection in dogs. If dogs have this, but the parvovirus which causes infection in dogs is totally different from what it causes in humans. There are two different kinds. In dogs, it's usually fatal. So we'll go to the next last question of this round for Dr. Shankar. Can we have the last question, question number 5 displayed? Yeah. To prevent the first attack rate of rheumatic fever after an acute group A streptococcus pharyngitis, appropriate antibiotic should be instituted before A, 3rd day of the illness, B, 5th day, C, 7th day, and D, 9th day of the illness. Your time starts now. Which is the correct answer?
Option B, 5th day.
Option B, 5th day. So I don't think so. This is the correct answer. Sir, Sukumaran sir, you want to, the correct answer is actually ninth day. Before 9th day of the illness, you have to.
So, you know, the streptococcal infection can lead to acute rheumatic fever and also acute post-streptococcal glomerulonephritis. This can be prevented by giving the antibiotic. The antibiotic of choice should be amoxicillin, should be given before the 9th day of illness, before the 9th day. This is a classical decision. As I said before, we are injudicious using amoxicillin, so the incidence of rheumatic fever has come down also.
We have to give it for 10 days. That is very important because many instances people are giving antibiotic for 5 days. That's not right. To correct dose of sore throat, the antibiotic should be for 10 days. It is up to 9 days and up to, you have to give 10 days of duration. That is also very important.
So even if we start the antibiotic on the 9th day, we have to give it for 10 days.
10 days.
So that is very clear, whether you start on day 1 or day 9. Okay, so this is very important, though we are saying that we are seeing less of rheumatic fever, but probably with the new criteria as we have discussed, we'll be catching up more patients. So at the end of the first round, Uma, can we display the marks? Okay, so all have scored except for Dr. Shankar. Don't be disheartened. There are 3 more rounds to be gone and there's a buzzer round also. So for the next round, I'll invite my co-quiz master, Dr. Balivant to please come. So we will go this way only, na?
So we'll go for round 2. It's a case-based round. So we can display the question. So this is an instruction. One question will be asked for each candidate, and each question carries 10 marks to be answered in 15 seconds. And this round have a special one. It's kind of a passing round. If the first candidate has failed to answer correctly, the question will be passed to the next candidate, but there won't be any extra time. The candidate should answer the question immediately. The mark will be awarded 5 marks for the second candidate. Suppose the second candidate also fails, the round will not move further. The answer will be displayed. Correct answer will be displayed. Yeah, we'll go to the round. Yeah, we'll go to the question. A 5-year-old boy presents with a high fever and poor oral intake for 2 days. Developed a rash, strawberry tongue, and cervical lymphadenopathy. What is the most likely diagnosis?
Kawasaki disease.
Okay. Answer is scarlet fever, B measles, C Kawasaki disease, D rubella. The candidate answered Kawasaki disease. Actually, it is we have to move for the another candidate. The next candidate can answer.
So scarlet fever.
Scarlet fever. Okay. See, sir, anything further discussion? We can go for it. So, second candidate, can I ask why you are saying scarlet fever?
So for Kawasaki, at least there should be 5 days of fever, and most of the experienced doctors also catch it by day 3 of the fever, number 1.
See, what is the criteria for diagnosis of Kawasaki's disease? 5 criteria are there. What is the criteria? Criteria of Kawasaki.
Yes, sir. So fever more than 5 days. Along with that, sir, rash will be there. Rash can be any type of rash, or eczema multiforme will be there. Then non-purulent conjunctivitis will be there, sir. Then lymphadenopathy will be there. Unilateral or bilateral. Unilateral is more common, sir. Then rash, strawberry tongue or mucositis, sir, will be there, sir. And
for my students, I usually say, you must remember this tip. My tip is my heart. MYHEART. My stands for mucosal changes. You have already described mucosal changes like strawberry tongue, then crackling on the ribs, then mucosal changes. Y is not important for me. For me, I is important. So I will delete Y. H stands for hand and extremity changes. Mainly, palm will be erythematous, and second week you will get desquamation of the palm. Then E is eye changes. You said it is a non-purulent conjunctivitis. Then R stands for rash. Rash is a truncal rash. A stands for adenopathy. Usually unilateral cervical adenopathy, mainly anterior cervical. T stands for temperature. Temperature lasting for more than 5 days. So in a child with high fever lasting for more than 5 days, with for the 5 criteria, you diagnose Kawasaki disease. But scarlet fever, why you diagnose scarlet fever for this child?
just looking at the days of fever, sir. And here the classical, the sandpaper rash is not given here, but still the days of fever is very important here. And also, yes, sir, that will be, I think.
Yeah, this child is presented with a rash, then cervical lymphadenopathy and strawberry tongue. Most probably it will be scarlet fever.
Yeah, very clearly mentioned that it is for 2 days only. In Kawasaki, it should be more than 5 days.
Correct. So the duration of the fever is very important in this case, and also minimum 4 principal criteria should be satisfied out of 5 criteria, but here also it's a 3 only. We can't say it is incomplete also. So based on this all parameters, we are going for the scarlet fever. Correct. All
That's
the
most of the times we diagnose Kawasaki by discommission of the skin, periangular discommission. Thus, yeah, discommission can also occur in scarlet fever.
prolonged
Viral
fever.
fevers also.
Yeah. Right. 5 criteria not satisfied, but the fever is prolonged, then other incomplete criteria like inflammatory marker and other parameters can be followed.
And also echo.
Yeah, echo. Echocardiogram.
And
Okay. So here the answer.
Kawasaki will be diagnosed only after 5 days of fever, not before 5 days of fever. And most of the time, Kawasaki disease is missed because we are not thinking of Kawasaki disease. So the fever actually continues, and we keep investigating in terms of any other infection is there. And then suddenly somebody comes and sees all these criteria, which Dr. Kumaran mentioned. And then you start thinking, this is Kawasaki's.
Yeah, especially when there is a redness and a swelling in the palms or soles. Even in the 4 days of fever, we can diagnose the Kawasaki disease based on the recent criteria. And we'll go to the answer is scarlet fever. This is a reference. We'll go to the next question. Yeah, mark is a 5 mark to the B candidate. Yeah. Yeah, next question is for candidate B. A 12-year-old student presents with the fever, sore throat, and a posterior cervical lymphadenopathy. With which pathogen is most likely responsible? A. Streptococcus pyogenes, B. Epstein-Barr virus, C. Adenovirus, D. Influenza virus.
Sir, Epstein-Barr virus, sir.
So the B candidate locked answer B, Epstein-Barr virus. So Epstein-Barr virus is the right answer.
What are the other features of infection with Epstein-Barr virus? It is only given as a posterior cervical lymphadenopathy.
What are the other clinical features of Epstein-Barr virus infection?
So infectious, for telling Epstein-Barr virus, sir, other like the flu-like symptoms will be there, sir, number one. Apart from that, lymphadenopathy, they have said. Typical viral prodromes will be there, fever, high-grade fever will be there, pain abdomen will be there, sir. Coryza, and along with that, there will be vomiting, sir, symptoms like that.
In Epstein-Barr virus infection, the typical features would be the presence of fever, generalized lymphadenopathy, and also you always look for epitrochlear lymphadenopathy. Epitrochlear lymphadenopathy is there, is most probably it is Epstein-Barr virus. Other is periorbital edema. Periorbital edema is very typical. Then you have a rash, then hepatosplenomegaly may be there. And liver involvement in the form of clinical jaundice may be seen in less than 10%. But SGPT elevation is seen in more than 75% of children. So fever, a rash, generalized lymphadenopathy, epitrochlear lymphadenopathy, hepatosplenomegaly, these Epstein-Barr virus.
Yes, actually, it's a very close mimicker of a streptococcal pyogenes, a streptococcal throat. Most of the time, when you are seeing the exudative tonsillitis, along with some cervical lymphadenopathy, always check for the generalized lymphadenopathy by seeing the axillary and epitrochlear region. And splenomegaly is very, very important. We have to caution the patients. Sometimes the spleen get enlarged for few weeks together. If the child is involving in the some contact sports like a football or something like that, the possibility of the splenic rupture is high. Correct. So the child need to be monitored further. And
the splenomegaly, as doctor said, is very important because the spleen is very friable at that time, and your examination also can make a difference in the way you examine and cause splenic rupture.
And there is one criteria called Hoagland criteria. So where the fever, exudative pharyngotonsillitis and lymphadenopathy, plus the lymphocyte count should be more than 50% in peripheral smear or the CBC. And in that more than 10% should be the atypical lymphocytes. If it is satisfied, clinically we can more suspect the Epstein-Barr virus.
Another question to PGs. What is the other name for atypical lymphocytes?
Infectious mononucleosis.
Yeah, other name for atypical lymphocytes.
Glandular fever, kissing.
No. For atypical lymphocytes. Atypical lymphocytes will be there. In your cell, starting from D.
Rest of
Ole.
you can also try. Rest of you can also try to
Yeah,
answer.
these questions will not carry any marks. You can
Ole body, sir.
No? Anybody can answer? Yeah. This is called downy cells. You know how many types are there? How many types of downy cells are there? You must read about this and show and see the pictures of downy cells. 3 types are there. Downy type 1, type 2 and type 3. You must find out what it is.
So this is MPhil level question. The other thing with Epstein-Barr virus infection is extreme fatigue, and it is known also to be a cause of the chronic fatigue syndrome.
And also Ravi, they can present the respiratory obstruction.
Yes.
They can present stridor.
One practical point is that fever, sore throat, posterior cervical lymphopathy is very common. In all cases, you just palpate the spleen. What we are doing clinically, the spleen, then we are suspecting Epstein-Barr infection, because other condition you won't get that much. Other things you will get it. But short duration. So friability is commonly mentioned. Falciparum malaria spleen and Epstein-Barr virus spleen liable to rupture. But clinically, I don't know. Means I have not met any condition like that. But anyway, in case of fever and posterior sore throat, I look for the splenomegaly. Very good sign, I think.
Specifically, the streptococcal pyogenes produce the anterior triangle cervical lymphadenopathy. Adenovirus, typically it is a preauricular. Preauricular lymphadenopathy will be there.
One question open to all the candidates here. Which malignancy can it lead to in the future life?
Malignancy associated with Epstein-Barr virus infection.
Burkitt lymphoma.
Yeah. Any other? Any other? One is Burkitt lymphoma, right? Any other?
Hodgkin's lymphoma.
No.
Non.
No. The other thing in the nose? Nose? Oh, nasopharyngeal carcinoma. Nasopharyngeal carcinoma. Okay.
Well done.
Okay. We'll go to next. This is a reference. So the third question go to team C, Dr. Vijaya. A 2-year-old child present with the high fever followed by a generalized maculopapular rash following exposure to another child with the similar symptom. What is the most likely diagnosis? Option A, roseola. Option B, chickenpox. Option C, hand-foot-mouth disease. Option D, fifth disease.
Option A, roseola.
Sure. Oh, so the candidate locked answer A, roseola. Roseola is the right answer.
What is the other name for roseola?
Infection subitum.
Huh?
Infectious subitum.
No, it is not infection subitum, something related to subitum. What is erythema infectiosum? Erythema infectiosum is a fifth disease. This is roseola infantum, or it is called exanthum subitum. So how will you differentiate between exanthum subitum and fifth disease? Some clues?
This is there is a slap cheek appearance.
In fifth disease, the classical feature is a slap cheek appearance. Slap cheek appearance will be there. Then roseola, this will be a very high fever. High fever lasting for nearly 3 days. And fever subsides first, followed by rash. Fever subsides first, then the rash appears. Whereas, what is the relation between fever and rash in measles?
The rash increases along with fever as the fever increases.
The rash appears at the peak of fever in measles. In the peak of fever in measles, the rash appears. And as the fever subsides, the rash also disappears.
Okay, nice. So next.
There is one more question I ask. See, hand-foot-mouth disease we are commonly seeing now. What are the problems produced by HFMD? Any complications? Is it a mild disease or can it produce severe disease? Yeah, anybody can. Complications. Hand-foot we see it is a mild disease because of skin involvement and fever, but it can produce some serious problems. Yes, right?
Encephalopathy.
No, it's a common produce aseptic meningitis. Any more? Other it can produce ADEM, acute event-related encephalomyelitis, and also it can produce myocarditis and ARDS. So rarely it can produce severe complications, right?
Okay. So the candidate get a full mark, and we'll go to the next. So a 5-year-old boy was admitted with the respiratory distress. On examination, a grayish white membrane is seen over the soft palate. What is the most common complication seen in this condition? A. Myocarditis. B. Palatal palsy. C. Respiratory failure. D. Renal failure. Your time starts now.
A. Myocarditis.
What is the diagnosis? What is the diagnosis?
Diphtheria.
Okay, probably. Partial diphtheria. What are the other complications of diphtheria? Other complications of diphtheria?
Yeah. So it's passed to the next candidate.
Complication.
Yeah. What is the answer? You have to say that.
Palatal pulse.
Palatal palsy. The second candidate logged palatal palsy. So the round may not go further. So we can ask the woman to display the answer. So respiratory failure. Here the catch is the, see, all are complication, I mean, except the primary 3 are complications of the diphtheria only. But what is the most common complication seen in this condition? This membranes, pseudomembranes, which is in the over the tonsil and the soft palate, it will go on to block the respiratory path. So it will lead into respiratory failure, sometimes will lead into intubation and mechanical ventilation also. So the most common complication of the diphtheria is respiratory failure. So the right answer is C.
The most common cause of death may be myocarditis because we had an epidemic of diphtheria there, and many patients we cannot survive because of the myocarditis. Respiratory failure, we can put the endotracheal tube and we can save the child, but myocarditis sometimes they may be very resistant, so we have to give some symptomatic support and like that. Respiratory failure is common, but the common cause for death may be myocarditis.
But a senior pediatrician like me, I am over 70. I have seen a lot of children with diphtheria. Actually, we had a diphtheria ward in our hospital. Diphtheria ward was there. We were treating all children with diphtheria. The clue for myocarditis is that a child with a diagnosed diphtheria, if the child present with vomiting, the vomiting may be the earliest symptom of myocarditis. You must watch for myocarditis. And you know what is the drug of choice? What drug can be given for myocarditis of diphtheria? Any drug that can be given? Other than the usual treatment of myocarditis, any specific drug? Is carnitine. L-carnitine is found to be effective for diphtheritic myocarditis.
And sir?
Is L-carnitine.
And one more, sir. This myocarditis usually seen in the second week of the illness.
Yeah.
Second week of the illness.
Myocarditis, even the palatal pulse also from second week. Some polyneuritis and all from third week of.
You may not mention whether it is immunized or not immunized.
Which one, sir?
Immunization.
Yeah. It's not mentioned. Yeah. Yeah, nobody gets any mark. So the next question. If required. So Dr. Shankar, the question is, a child is brought with the fever, convulsion and the signs of meningeal irritation. CSF examination shows increased protein, reduced glucose and increased leukocytes, predominantly neutrophils. What is your diagnosis? Option A, bacterial meningitis. Option B, viral meningoencephalitis. Option C, fungal meningitis. Option D, aseptic meningitis. Your time starts now.
Bacterial meningitis.
Okay. Bacterial meningitis is the right answer. And generally the CSF examination shows predominantly neutrophils. Sometime in bacterial meningitis, if you see the early stage, lymphocyte predominance may be there, followed by neutrophil predominance may go. In the reverse, like a viral or aseptic, initially sometimes neutrophil predominance will be there, then go to the lymphocytes. And the reduction in the glucose may be the clinching point here. And increased protein can be seen in even the viral also. And in fungal, you can get the same like increased protein, but the sugar may be.
So in which meningitis, viral meningitis will get a low glucose level?
Septic meningitis.
Mumps, herpes zoster, chickenpox, and lymphocytic chorea meningitis. All this will get a low sugar level.
Yes. And I think this round is over. Yeah. Can we see the cumulative marks? So, the candidate Chinmay scored 25 marks, and the first candidate is Sonu Prajapati 10, and Vijayashree 10, and Shankar 10, and Dr. Vijaya is 20. So, the Chinmay is scoring highest mark 25. From here, no, sir. Next. Yeah. No. Okay. Sir, next round I'm calling Dr. Vishwanath.
Good morning, everyone. And I hope you're all enjoying the game here. This is an image round with MCQs. This is a round 3. And we will start from E, D, C, B, and A, rather than going from A to E again. Can we have the rules on the display, please? So this is a picture round. We start from E to A, and all of you must answer this. The pictures will be displayed on the screen as well as on your tab. The person to whom the question is asked, if he answers it right, the rest of the responses will be null and void. But if the person who is asked the question does not answer it correctly, and rest of the candidates answer correctly, or some of them answer correctly, they will get 5 points. Total time for each person is 15 seconds. Is that clear? Anyone has any questions about it?
So one small.
All of you check your tabs.
Yeah.
Can you please check your iPads and ensure they are unlocked so that you know that you are able to answer the questions? So it's all 15 seconds. Everybody should answer the question in 15 seconds.
Excepting the person to whom it is directed.
No, everybody.
On the tab.
Everybody is answering the question within 15 seconds.
Sir, suppose you direct the question to candidate E. He will reply. He is not doing it on the tab. The rest of them are doing.
He will answer the question while on the mic, but rest of the 4 candidates will answer on the tab. Is that clear?
No.
If he
Within
replies,
15 seconds, you people will do.
so 15 seconds is given. Within 15 seconds, you all have to answer. He will answer orally, verbally. And after 15 seconds, the answer is going to be displayed. All who of you have answered it correctly will get 5 points each.
If
he is not answered correctly. Yeah. The caveat is he must answer correctly. No one will get a point. If he is not answered correctly, whoever else has answered will get 5 points each. Correct. Can you have the first question, please? So the first question goes to Shankar E. A 3-year-old child presents with a 5-day history of high fever irritability and a rash that started on the trunk and spread to the extremities. What is the most likely diagnosis? A. Measles, B. Chickenpox, C. Roseola, and D. Kawasaki disease. Your time starts now.
Chickenpox.
Okay, I'll wait for 15 seconds for everybody else to answer, and then we'll get the answer. Okay, can you put the answer, please? Chickenpox is not the right answer. Roseola is. And can we put up? It's not working. You got the questions? Have you got the questions? You two have got the questions. Did you get the question on the time? You didn't get the question on the time.
Cancel.
Yeah, we'll cancel this. We'll cancel this question.
See,
Can we just check that all the tabs are working, please?
yeah. See, before you cancel you can cancel the questions.
Shall we cancel the question?
Yeah, yeah. That may be better. They can write down. They can write down the answer. See, before you go for the next question, we have a discussion of this question. What is the answer?
Apologies for this technical glitch.
Yeah.
I think what we will do is give you chits, which you all have to answer on, and we'll collect the chits. You have to write your position A, B, C, D, E, and then you have to answer. Correct. And all others will write the answer.
Yeah, and we collect the answer
and
see
then
whether
we
it's
collect
correct
the
or not.
answer.
And correct.
And then
All will write.
the only concern will be, they have to, we have to transport these answers to them.
No, you can just bring it. See, it is easy. See, the first person should answer the answer. Then others can write the answers in the paper.
Correct.
And give that paper.
Correct.
Then correct answer we will get 5 marks each.
Correct. Did you all get that?
No. What is no?
So you start with him again.
Correct.
So we will cancel this question. Or?
So you all get 15 seconds to answer. We will collect your responses, but the first person will answer it verbally.
So we will cancel this question and
We
start
cancel this question. Can you have the second question, please? Okay, the second question goes to you, Shankar. A teenager presents with fever, headache, and a rash that started as a small red spot and developed into larger lesions. What is the most likely cause? A. Varicella, B. Meningococcemia, C. Rubella, and D. Erythema infectiosum. Your time starts now.
You can reply.
You can reply. You can reply. Meningococcemia.
Okay.
Can we collect the responses from everyone, please?
No, just say the correct answer.
It is Bangdor. It is meningococcemia.
So
the answer is correct.
no.
So the rest of the answers, whoever has mentioned correctly, will not get any point other than
the first person who answered.
Other than E.
See, we will ask few questions.
Can we have the right answer, please?
Right answer we know it is meningococcemia.
Meningococcemia.
Okay, why it is meningococcemia? Sanga, why it is meningococcemia? Eh? Why? What is the diagnostic criteria? What is there? So there is fever, headache. It may be meningitis and just a rash like this. What is Waterhouse-Fredrickson syndrome?
Hemorrhage in the
Waterhouse-Fredrickson syndrome.
adrenal gland hemorrhage will be there in meningococcemia.
Okay. How can you prevent meningococcemia? Can you prevent? For contacts, what will you do?
Contact, we'll give rifampicin prophylaxis.
Rifampicin. What is the dose of rifampicin do you give even? And how long will you give rifampicin? Dose?
10 mg per kg.
Oh, you 15 milligram per kilogram body weight. For how many days? Oh, you must study all these things. Should be given for 2 days. See, why it is not varicella? What is the duration of fever in varicella? What is the duration of fever in varicella? Varicella is a very common infection. Eh? Fever in varicella. No, fever. I am asking about fever, duration of fever in varicella. Chickenpox, very common infection. No, 1 or 2 days. This children will have very high fever. Headache will be intense. 1 or 2 days. Then rash develops. Rubella. What is the other name for rubella? What is the other name for rubella?
German measles.
Any other name? Any other name? This German measles, right? Any other name?
3-day fever like that.
It is always called 3-day measles. It's called 3-day measles. Measles, the fever is nearly 5 days. And in rubella, it is 3-day measles. Erythema infectiosum, what is the other name? Other name for erythema infectiosum, we have already discussed.
Fifth disease.
Fifth disease, right. So the correct answer is meningococcemia in this child. See, what is the drug of choice for meningococcemia? How do you treat? Yes?
What's the medicine of choice?
Yes? Penicillin. Oh, okay. Which penicillin? Penicillin G. But now we are giving ceftriaxone. Now it is ceftriaxone. Previously we were giving penicillin G. And I have seen children with meningococcemia who develop severe vascular thrombosis, arterial thrombosis, which has resulted in amputation of the leg also. Years back.
It is very debilitating disease unless it is controlled fairly aggressively at the onset. Sometimes it still progresses, and as Sir said, meningococcemia will lead to meningitis and digital problems and kidney problems and multi-systemic disorder, leading to even deaths.
Yeah, see, the vascular thrombosis is correct. Here also, if you see the purpura fulminans, it is a dermal microvasculature thrombosis, which is causing this lesion.
The
Okay,
chemoprophylaxis is only for short-term duration. But if you really want to control an epidemic, then vaccination is the method. Okay?
So Shankar E gets the full points. Can we go to the next candidate, please? This is for you, Vidyashri. So the question is here, a mother brought her 7-year-old child to the OPD because of fever and facial swelling for 2 days. He has not been vaccinated since birth because of his parents' fear of side effects. On examination, swelling is noted in the jaw. Which of the following statements is true? A. Meningoencephalitis can precede parotitis. B. Salivary gland involvement is limited to the parotid. C. Patient is not infectious before parotid enlargement. D. Orchitis leads to infertility. Which of the following statements is true? Your time starts now. And everybody please respond.
Right.
Orchitis leads to infertility.
Okay. Can we have the answer, please? It is meningoencephalitis can precede parotitis. And can we also, that's a wrong answer. So we have to collect
the correct
the
answer.
responses and correct ones. So D does not get any point, while who has answered it correctly, please?
There are 3 people who have answered it rightly. Team B, answer option A has been ticked. Team A, option A has been given. And C is given option A.
So three teams gets 5 marks each. 5 marks each. 5 marks each.
Well,
Team A is
out
Tonu.
the wrong answer from team E, which is given a C option.
So team A, Sonu gets 5 points. Team B, Chinmay gets 5 points. Team C,
5 points.
5 points. Team E,
Wrong answer.
okay, wrong answer.
Yes. One more question. What are the complications of other complications of mumps?
Center also.
Myocarditis,
Aseptic meningitis.
pancreatitis.
In orchitis, euphoritis,
No, then all itis are there. Then
meningoencephalitis, encephalopathy,
what are the other
Pancreatitis.
CNS complications?
Aseptic meningitis. and
SSP,
SSP is not.
No,
No.
longer complicated.
That is with measles.
mumps related encephalitis, which is a rare entity.
Then what are the CS of pen is in mumps meningoencephalitis? What pleocytosis?
Sugar low.
Low.
Like
What is the usual cells? Lymphocytes or polymorphs? Lymphocytes can be there, right? How can you prevent mumps? Prevention of mumps by the national program. Is there a national program for prevention of mumps? National immunization schedule. Which vaccine is given?
MR vaccine.
Can it prevent mumps? No, it is quite unfortunate that still mumps vaccine is not included in the national program. But IAP recommends how many doses of MMR? How many doses of MMR by IAP? 3 doses. When? The answer is right. 9? No, 16 to 18 months. It is 15 months.
Yeah, answer is
And?
because of you.
And? 5 years. Right. Okay.
So we used to see lots of cases of mumps very long back. Commonest cause of meningitis at that time, it is mumps around 10-15 years. When we are giving measles alone, old story. Then we started MMR. Again, now we are giving MMR. So it is again time for we are to suspect. Because we are not giving measles routine in government. We are working in government students, so we are not giving mumps now, vaccine now. So again, you are to suspect any case with meningoencephalitis, you are suspect mumps first.
We had recent spike in mumps. Everybody knows last year.
Now also we are having an outbreak of mumps now, but still our government is not including mumps vaccine in MMR. See, one more question. Suppose a mother develops mumps during antenatal period. Pregnant woman develops mumps. What are its effects on the baby? Antenatal mumps. Any CNS problem in the baby?
CNS and liver, I would suspect. Transamminases will be raised.
One CNS problem. What is the commonest cause of hydrocephalus in a child? Congenital hydrocephalus is acute stenosis. The mumps in the mother can produce acute stenosis in the baby, acute stenosis. Then baby can also have a cardiac problem. What is the cardiac problem seen in babies with maternal mumps? Any idea? Say the full name. Full name.
Endocardial fibroelastosis.
This endocardial fibroelastosis, EFE. First one is acute stenosis and second is EFE, endocardial fibroelastosis. Right.
Okay, we have logged all the points, madam. Shall we go to the third question, which is coming to you, Vijaya? Can we have the question, please? The stool examination shows the following findings as shown in the image. Identify the causative organism. Your time starts now.
Option A, Trichuris trichura vipor.
Trichuris trichura. Okay. We wait for 15 seconds. Can we finish the 15 seconds and then answer? Yeah. And then collect the answers. Yeah, you're right. Trichuris, can we? Trichuris trichura is the right answer. So you get full points. None of the others will get any points.
Yes.
What is full points to Vijaya? C.
Say Vijaya, what is the problem produced by Ticura infection?
Problem.
Yes? What's the problem? Clinical manifestation.
Sir, Vipvam.
And there was an answer here from Chandramohan. But he has not listened to that. You must listen. So the main problem is it can produce a colitis.
Colitis.
Vipvam colitis. And it can produce prolapse.
Rectal prolapse.
Prolapse. Rectal prolapse. What is the drug of choice?
Metronidazole plus ivermectin.
Ivermectin? Albendazole. Albendazole. Well and good. Okay.
Okay. Shall we go to next question? Next question comes to you, Chinmay. The 3-year-old child has had fever for 4 days and a rash for 3 days. What is your diagnosis? A. Scarlet fever. B. Hand, foot and mouth disease. C. Kawasaki disease. And D. Measles. Your time starts now.
Hand, foot, mouth.
Is that right?
No. You can answer.
Hand, foot, mouth disease.
Okay, we wait for 15 seconds and then collect the things. And can we display the answer please?
Yeah.
It is actually scarlet fever, not hand, foot and mouth.
Yeah.
You can see there's a strawberry tongue there.
See,
and
hey, what is the manifestation of hand, foot disease? You said hand, foot disease. What is the main manifestation of hand, foot disease, hand, foot, mouth disease? Just see the picture.
Yes, I thought that was like inside. I could not see. I thought it was herp angina or something.
Is it herp angina? It's only membrane. It's not herp angina. And what is a rash like in HFMD?
Okay, so rash. So can we finish off the question? Can we get the answers? Who's got the?
Team A has given A answer. Team E has answered A. And team
Krishnamar, you must use a better glass.
No.
So Chinmay, team B does not get any marks. Team A, Sonu gets 5 points. And who else gets 5 points?
Team D. Yes. And team C, there is a wrong answer. Option D has been picked.
Okay. See, you should not talk about wrong answers. You should say about correct answers. No, correct answers. No.
A, D, and E get 5 marks.
A, B, and E get 5 marks, and B doesn't get any points.
See, coming to the question of hand, foot, mouth disease. What is the type of rash seen in hand, foot, mouth disease? Is it like this? And where is the rash seen? We are seeing a lot of children with HFMD now. What is the type of rash?
Maculopapular rash only will say.
Macular is mainly vesicular rash. Where is it confined to?
Palm, soles.
Palm, soles, buttocks.
Now it is called hand,
Elbows.
foot, mouth and buttocks disease. They have changed now. HFMD it is hand, foot, mouth, buttocks disease. It's mainly confined to buttocks also. Yeah. And it is a vesicular rash. No, it is not like this, vesicular rash. And this is a membrane like this. And also, it is herp angina. Herp angina, ulcers should be there. What is the organism that produce HFMD?
Coxsackie,
Which
A16,
Coxsackie?
and A16, sir.
Yeah?
A16, sir.
Then?
And enterovirus 71.
Yeah, right.
The most common cause is A16.
What is the problem with enterovirus 71 if it causes HFMD?
CNS manifestations are more with enterovirus.
Yeah, right. It will produce severe disease. It will produce severe disease. Okay, right.
Okay, we have the last question coming up in this round. Can we have the last question, please? Last question is to you, Dr. Somu. A 6-year-old presented with cough for 3 weeks. There is a history of contact with tuberculosis. Which of the following is false? A, most common site of extrapulmonary tuberculosis is lymph node. B, sputum smear negative does not rule out pulmonary tuberculosis. C, most cases of pediatric TB are asymptomatic. And D, Pool's lesions is seen in primary infection. Your time starts now. Everybody else can jot down their responses. Option D, and let us wait for the time to end. He says option D, and that is the right answer. Can you display the answer, please? Pool's lesion is seen in primary infection. A, Sonu. Is Sonu or Somu? Sonu.
So he gets
Sonu gets the full points, and none of the other candidates any points.
Okay. What is the X-ray there? See the X-ray. What are the findings in the X-ray? One of the candidates can say. You say C. Yes. C.
Hilar lymphadenopathy.
Hilar lymphadenopathy. Any other finding? Any other finding?
Prominent bronchoscopal markings are there.
What are the other findings you must look in the X-ray in primary tuberculosis other than lymph node?
Cavity.
Yes?
Secondary cavitary lesions.
In primary complex? No.
Secondary.
Cavitary lesion occurs in a reactivation tuberculosis, not in a primary tuberculosis. Can you see Ghon's focus in the X-ray? Ghon's focus may be seen, not in this X-ray. Not in this X-ray. You must look for a Ghon's focus. Then you can look for fissure thickening. Fissure thickening may be a feature. And main feature should be hilar lymphadenopathy. So what is the treatment of primary tuberculosis? How do you treat? Which category? In the EP, which category?
Drug sensitive tuberculosis.
What is the treatment? Which category?
Category 1.
What is category 1?
HRZD for HRZD
for
6 months. For intensive phase 2 months, followed by continuation phase for 4 months.
So you say 2HR is a D, followed by 4 HRE. That's the correct. Okay.
And
Thank
also,
you.
So this pulse lesion seen in chronic pulmonary TB, usually in the apical region. And also there is another lesion in the infraclavicular region. What is it called? Asman focus.
Thank you. That ends the third round. And can we display the marks for the third round, please? End of third rounds. So we have Sonu Prajapat on 30, Chinmay on 30, Vijay is leading at the end of the third round with 35, Vidyashree is 15, and Shankar is on 25. You still have the buzzer round going where you can score points. And best wishes, can I request Madam to come in again?
So this is going to be a very interesting round, the buzzer round. So all of you have got buzzers with you. So when we ask a question, yeah, we are just getting it checked.
So that everyone will be familiar with it. You can see perhaps the buzzer can be near to you.
So what we'll do is I'll ask Dr. Yagnesh to give a buzzer round demo question. Please give a demo question for the buzzer round from your end. Yes, just ask them anything and let's see who presses the buzzer.
Yeah, before that I'll just see, all of you can see there are buzzers kept in front of you, and right now there's a blue kind of a light display. That means the buzzers are active. So just place your fingers onto it. Don't press, just place your fingers onto it. It's in action, okay? So if you press, whosoever presses the fast, that glows in green and the rest of the buzzers goes off, light goes away. And since already she has pressed it now, that buzzer, team D buzzer is on now. If E wants to press it again, it will not, because it will not function. That means that is the fastest finger. So that is how the buzzers are placed. Unlock money.
Okay. You give one question.
So one general question. So
General question, whatever is your choice.
okay. Okay. Now
You took so much, the rest of the people.
see, for that trial question, the team C buzzer is glowing with green. The rest of the buzzers are off. Even if you want to press it now, it will not, because you are the second fastest or the second finger there. Clear, all of you? Sir?
It won't pass.
So
Fine. So we are comfortable, all of us? Huh? हाँ, 5. हाँ, ठीक. So whoever answers fastest will get 5 marks, okay? And as per the advice of the jury, we are not keeping any negative marks. 5, yeah. That I've. Oma, you please note it is 5 marks. Okay, so I think all of you are comfortable, clear? Don't press now. Don't keep your hand off. Okay, otherwise we will not know. Huh? So you let the question be completed and then you press the buzzer. Huh? Okay. Huh? ठीक है? Just keep your hands on top of the buzzer but don't press it. Should we start, sir? Yeah. Yes.
Before you finish the question, then disqualified.
Disqualified?
Or you don't read out the question, just let them see.
Just display, madam. No need to
Just
read out.
display?
Yeah.
Okay, and then let them read and within 15 seconds. Okay, Uma, you got the point? When the question comes, you just display you start the timer also. Okay, so kindly display the first question. So your time starts now.
Ma'am, Lyme disease.
Okay. So the candidate B, Chinmay Jaina. Buzzer, yeah. Green. So he has answered Lyme disease. Okay. So this is the correct answer. So Chinmay gets 5 marks. So you want to add anything, Anand sir, on Lyme disease?
No.
Lyme disease, yeah. You can't see, no? He is having a problem. Can we shift this a little this side? Podium को थोड़ा इस तरफ कर दो.
Crew team.
He is not able to see the option neither from here or from there. It is coming, but again he is having problem. So otherwise, what you can do now, you can shift the candidate. Or podium you can put it. Podium to shift.
Madam, I mean there, and he can put.
Yeah.
Your seat can change. Your seat can change it.
See, Lyme disease is not a very common disease here. We are not very familiar with Lyme disease. Lyme disease usually present with a skin rash, and meningoencephalitis is very common with Lyme disease. Okay.
Yeah. So with that, I think we will move to the next question. You have deactivated, okay. So we go to the next question. Can we display the next question, please? Who pressed? Okay.
Yellow fever.
So did you read the question or you just pressed? So we'll allow the audience to answer.
Yeah.
Dengue fever. So you see, you should read the question properly, huh?
Yeah.
Dengue. Breakbone fever is dengue.
No marks.
So no marks will
No
be given.
marks.
This goes off.
No marks.
No marks. So you want to say why it is called breakbone?
Why
fever?
it is
Because
breakbone
they
fever?
are confused with chikungunya.
Why it is breakbone fever? Yes? Because of fever?
So otherwise you'll not get marks.
What is it, madam? What is the confusion? Yes?
So they are saying that she didn't answer correctly, but we answered. So why we did not get the marks?
But she was first.
To press the buzzer.
You should.
Before seeing the question, he already pressed, so that is green, and then they read the question later on. So that's a fallacy.
That's a fallacy of this round.
That is a fallacy is there.
Negative mark.
Yes. Yeah. So what you do is you please, now all of you read the question first.
Then plus. Then plus.
Or I think what I should do is I'll read the question. When I finish reading, then you press. Okay? Okay.
Okay, right.
So we go to the next question. No. What is the classic triad of symptoms in Rocky Mountain spotted fever? Fever, rash, history of tick bite, cough, weight loss, night sweats, fever, jaundice, hemorrhage.
Option A.
Option A. So can we display the answers, please? Yeah. So the correct answer is fever, rash, history of tick bite. Pardon? You were supposed to do it till the last option.
See, the madam will say the question, madam will say the answer, then you start pressing. Not before that. Not before that. Not before.
Not before.
Finish reading, then the timers will start. And before timer, nobody should press the buzzer.
So I'll take a mic from you.
This also is cancelled.
This. Name, no
Yes,
marks.
yes.
Yeah, cancel.
Cancelled.
But you should have enough questions then.
No, we have, sir.
Okay, then that's all. You cancel.
We have.
You cancel.
Anyway, it's a buzzer round.
Yeah.
So now is it clear? Huh? If you press the buzzer before I finish, then you're disqualified.
Disqualified.
That's why we wanted negative marks, sir. That's why.
Now we will not follow negative marks, madam. You.
We'll go as
Yes,
such.
as such. Okay.
Okay, next question.
So are you clear that when I finish reading the last choice, the timer will start. During that timer will start, then you press the buzzer, okay? Can I have the next question, please? Which cytokine is primarily responsible for the febrile response? A. Interleukin 4, B. Interleukin 1, C. Interleukin 10, D. Interleukin 12.
Option B, interleukin 1.
Okay. So this we will take because she has pressed the buzzer after I finished the question. So the answer is B, interleukin 1.
Right.
Fine? Huh? The first valid question. So
She
C
gets
will get 5 marks. Okay. So Vijaya will get 5 marks. Fine? So you want to add anything on the other interleukins?
No.
Which are displayed? 1 and 6. Yes, and TNF. Right.
And interleukin 10 actually it will reduce fever.
It will reduce fever. Yeah. All right.
Interleukin 10. Right.
So we will go to the next question.
Right.
So we go to the next question. This is the first question, which is valid. So 5 marks to C, Dr. Vijaya. We go to the next question. Uma, can you display the next question? Endogenous pyrogens include all of the following except interleukin 1, interleukin 3, interferon beta, interferon gamma. Okay.
Mike.
Ma'am, interleukin 3.
Interleukin 3. Can we display the answer, please? Yeah, so he gets 2 marks. Why you said interleukin 3?
Ma'am, I ruled out the other options.
Right.
Very smart. He ruled out the other options. Because, sir, you already told the other options. So, this marks goes to Chinmay Jaina, 5 marks.
B.
Okay, answer is B. We'll go to the next question. Zyada nahi hai, sir. I get totally covered by the podium. The next janam I have to tell God to make me more 1 foot more taller. Did you? Okay. We will go to the next question. Yeah. Uma, can you display the next question? Yeah. Most common cause for serious bacterial infection in neonates and young infant. A. UTI. B. Upper respiratory tract. C. Meningitis. D. Gastro. You have pressed first.
Meningitis.
No. Huh?
It's UTI.
So as soon as I finished, they pressed. So it's valid. UTI. What about you people? UTI. So rest were all correct. It's wrong.
Yeah. Why? See, UTI is a very severe infection in newborn. Why? Because in most of the children with UTI, they may have associated obstructive uropathy. We've seen that more than 50% of newborn and in early infancy, UTI is associated with obstructive uropathy, with like posterior urethral valve, vesicular ureteric reflux. I think our friend nephrologist is here.
Think what we are missing a lot of UTIs, and the symptoms are very non-specific, and that is why we do not think of UTI. But as all of you are correct that UTI should be thought of in a newborn and a neonate whenever the child is having a serious infection.
So the catch in this question was, you have told us the most serious bacterial infection, but the catch in the question was most common cause. Okay? Yaad rahega? Theek hai. So nobody gets any marks in this question. Can we get the next question? All of the following criteria are used to identify febrile infants at low risk for serious bacterial infection, except Boston criteria, Philadelphia criteria, Rochester criteria, Ranson criteria. Okay.
All are pressed.
Philadelphia criteria.
No, ma'am. Option D, Ranson criteria.
So, Ranson criteria. So, wrong. Okay. Can we display the answer? So,
okay.
Yes, sir. You want to add on the Ranson criteria, any one of you?
So, where we use the Ranson criteria?
In up to 3 months, infant for diagnosis. I don't know, Ranson.
No,
I rule out.
Use it in the pancreatitis.
Yes.
Sir? No? Fine? Okay. So, nobody gets any marks in this. We go to the last question of this round. Which virus is commonly associated with viral hemorrhagic fevers? Adeno, dengue, rota, rhino.
Dengue virus.
Before.
So, you're correct, but we will not give you any marks. Why you didn't wait for us to finish? You want to add some more questions? No? ठीक है ना? One. Okay. Okay. Yeah. So we'll have 3 more questions. Okay. Are they ready? So this, nobody gets any marks. Huh? Actually, in other quizzes, we give minus if you do like this. So Uma, can I have the next question, please? 3 more. So which symptom is most commonly associated with dengue fever? Lymphadenopathy, hemorrhagic manifestations, encephalopathy, muscle stiffness. You did not.
You should not see. No. Candidates should not discuss like this. Only jury can say. No, we are watching it. No discussion for candidates. No discussion.
No.
Final is by jury. No.
Sir, what to do? He pressed first actually before I finished. And what was your answer? Muscle Stiffness. No, that is not the correct.
Earlier.
Huh?
So we
He pressed early.
cancel it.
We cancel this question. The actually correct answer, can you display the correct answer? So actually the answer is hemorrhagic manifestations. Okay. So don't be in a hurry to press the buzzer without understanding the question. Huh? Sure, sir. Huh?
Because 2 questions are there.
Negative marks. Okay. So think before you press. Huh? Yeah. Okay. Yes. This is the fallacy of the buzzer thing.
Okay.
Yeah. Next, can we have 2 questions? Last 2 questions. If they press the buzzer before time or they press the buzzer and they give a wrong answer, it will be negative marks. Okay? Yeah, please watch them. Okay. Please give the question. A child with fever, rash and lymphadenopathy is diagnosed with infectious mononucleosis. Which of the following laboratory finding is the most characteristic of this condition? Positive blood culture, positive heterophile antibody test, elevated C-reactive protein, elevated liver enzymes. Okay. Positive? Okay, so this is valid. He gets 5 marks. Positive heterophile antibody.
But this positive heterophile antibody test is also not very specific for IMN. You must look for IgM antibodies against Epstein-Barr virus should be looked for. And
out of these choices,
I'm telling, out of this the best answer is positive heterophile antibody test, but it is not very specific. And elevated liver enzymes you may see in 75% of children with IMN. But clinical jaundice is very rare.
Very rare.
IMN.
Okay. So 5 marks goes to Dr. Shankar. So we come to the last question of this round. A 5-year-old child is found to have propyridine deficiency. Which of the following disease is highly susceptible? A. Meningococcal, B. Pulmonary tuberculosis, C. Staphylococcal pneumonia, and D. Cryptosporidiosis. Okay. Shankar. Huh? Staph. Okay, this is the wrong answer. So display the right answer, please. So you get -5. Okay. So Shankar, whatever he got in the first question, you minus it. So the correct answer is meningococcal infection. So you want to add on this propyridine deficiency?
No, I don't want.
Anand sir?
Propyridine deficiency is a primary immunodeficiency disorder. Usually have a deficit in the complementary proteins. Yeah, complement pathway proteins. So it is the most common is the meningococcal, invasive meningococcal disease. Is most common.
So
What are the other conditions where you can get invasive meningococcal disease?
practically what we are seeing commonly is nephrotic syndrome. You have to give prophylaxis against meningococcal vaccine because propyrin factor and the complement factor is loose in the urine. So we have to give vaccine in addition to all capsular organisms, including meningococcal.
So if you have an asplenia or a splenectomized patient also, they will be more common. So thank you very much.
Madam,
And,
1 minute.
yeah.
The primary immunodeficiency, it's a kind of presenting as a X-linked recessive. So it's only common in the male children.
Male child, yes. So before they display the results, any other comments, sir? Vishwanath, Dr. Vishwanath?
Thank you very much.
Finish.
End.
If now we'll see the scores. If there is a tie, then only we'll go for a tiebreaker.
Yes, madam, I want to make a comment.
Yes, sir.
As a professor of pediatrics and as a teacher in pediatrics for the last 50 years, I have a lot of students I have seen, and I request all our PGs to read more.
Yes.
You must read more. And as pediatric PGs, you read Nelson from first page to last page. Yes, you read it.
Isaac, sir, what about medicine? Should we also read the medicine books?
Definitely, you must read Harrison. Harrison is your Bible, so you have to read it.
Because now we are seeing up to 18 years, no, sir?
Yes.
So Harrison also we have to read.
But now the students, they don't read Harrison and Nelson, they don't read. They read only local books.
Local books.
Yeah, small books.
Small books.
Small books and whatever is present online.
Online,
But
we didn't have that luxury at that time.
So if you go online, you'll make a mistake. Suppose you Google the question we asked about diphtheria, no? What is the most common complication of diphtheria? You just see what it says online. It doesn't say respiratory failure. It says myocarditis. So that is the fallacy of reading online.
But that is the requirement of examination. That is what is the issue.
My request is that at least we are older person, but at least read the hard copy once. You are just reading soft copy and it is disappearing like that from your mind. Because I studied in lesson 88, still 15th chapter is cardiovascular system, 20th chapter is nervous system, 22 chapters, everything I know still now. And I know which page it will come like that. So I think you read at least once in hard copy. While traveling and little hours, you can read the soft copy, that is true. But you should read a hard copy.
Yes, so you want to say something?
Yeah, thank you very much for all the participants and everybody gathered here. We have finished the rounds, all the 4 rounds, and let's have a look at the score.
Final scores, please.
If there is any tie, we have a further tiebreaker, and I hope we are not put into that tie-breaking situation. Only those two. Only those two.
Just before the final scores, the scores has been validated from the system, from the independent juries, as well as the other people from the back-end scoring team. We have validated and found to be correct. Anand, sir, for your final.
Thank you. It was an excellent exercise for all your PGs.
Sir,
I think
before we do the final scores, can I just distribute the gifts to the audience?
Okay.
So who had raised hands? Or who had answered? What do we have for them? Something nice?
Chocolates.
So only 2 people answered?
Yeah.
Yeah, yes, sir, you are there. Sir, you are going to get 2.
Not for the experts, sir. Not for the experts.
So he is the lucky one sitting next to you. Rest of you didn't. Okay. So how many we have?
But sitting there.
So we are giving it to the
all the juries
all
and
the juries, sir. If you don't eat, you can give it back to us.
Okay.
All are diabetic? Doesn't matter. So now we can display the final scores, sir. Yes, sir, please.
Right. Excellent exercise by all the PGs. And most of you had done very well. And as already suggested by the senior, that you must do a lot of reading. And reading is the only thing which will make you perfect. And I'll start with these scores. So, Dr. Vijayashri, you have got 15, and keep it up. And you need a little more intensive exercise. Then Dr. Shankar, you have 25 marks. You lost 5 marks in your buzzer round. Otherwise, you could have got 30 here. 25 marks. Well done. Then Sonu, you have 30 marks. And well done, Sonu. Again, keep it up. And after that, Dr. Chinmay, you have 35 marks. And you had answered most of the questions very well. And at the top, we have Vijay with 40 marks. Very well done. All of you are winners, as already said, but one had to score more, and Vijay is the one, and second is 35 marks Chinmay, then 30 is Sonu, and 25 is Shankar, and 15 is Vijayashri. Right?
Chinmay is 35. Chinmay is 35. No, the display in the second thing was wrong.
Chinmay is 35, yeah.
So thank you very much, sir. Closing remarks. Dr. Isaac, the independent.
They take a photograph also.
Yes.
Do photograph.
With them.
So I think we enjoyed this beautiful session in the morning. I must also congratulate the quiz masters because they have done a good job, right? So I think we will give a clap and congratulate them for the good work. And we also thank the experts for giving their opinion because it's a learning process. It's not just a competition alone, it's a learning process and we have learned lots from what discussed. I think congratulations to all the people who participated and the winner also. Right, so do well. We'll continue to have such quiz programs in the future also. I think we must raise our standards a little more higher and we'll be able to see better outcomes. Please remember what we said. Continue to read Nelson and continue to read Harrison, right? Okay, thank you.
Congratulations, Dr. Vijay, for an excellent performance. Dr. Chinmay, to you too. Almost everybody was good. But as you said, there is a caveat in the Gujarati. I will translate later in the English or Hindi. Dasarana divse godu na dode. That means that day when you require most, it will not work. So I have no doubt all of you are learned individuals, you are learning and you know major thing. But at the time of pressing a buzzer, you may be little late for a second or two and you miss the bus. So do not worry and do not get disappointed by losing. It is not a matter of winning or losing. It is a matter of learning. And it is never ending process. Even today, we are learning. I also learned a lot from your quiz. So learning never ends. So you please continue to learn and let us have a bright future we wish you a bright future for all of you. Thank you.
It is a very good teaching experience already mentioned. And as I told in the beginning itself, all are winners. And the losers also winners because recently myself and Dr. Anand lose the election. So it is not a problem. We are enjoying it. So that is we came here to enjoy it. And I think I have some requests to organizers. Around everything there's some promise that we will discuss later and we will rectify it. Krishna is here, no? Rectify it next time. Okay. Thank you.
I would just say that participation is more important than winning. And you all have participated very well with full energy and full enthusiasm. And that is what matters. Thank you.
So the quiz masters anymore? I think we learned a lot, no?
Participation is good, as everybody said, and I hope you all enjoyed this. It is not just that you participate, but you also enjoy. Enjoy plus the learning. The bigger faculty is here, esteemed faculty, and we learned so much from them. So much that we have actually learned and forgotten, and it's just come up again. Thank you very much, everyone.
Want to say something?
All the best for all.
Thank you. So what we'll do is we'll have a photograph here, and after that we will move to the Mysore Hall for the felicitation of the winners. So just arrange for the photograph. But the background should be made
Right.